Mesothelioma. Introduction.
Are all tumors cancerous? Select yes or no.
Correct. Only malignant tumors are cancerous. Benign tumors are not cancerous. What is the name of a tumor that invades other organs and body parts? Choose one of the following. 1. Malignant tumor. 2. Cancer. 3. Metastatic cancer. 4. All of the above. Correct.
Does mesothelioma usually start in the lining of the abdomen? Select yes or no.
Correct. Mesothelioma can affect the lining of the abdomen or heart, but it often starts in the lungs.
Does mesothelioma develop right away after breathing in asbestos? Select yes or no.
Correct. It can take a long time between being around asbestos and getting the disease. It can even take 30 to 50 years. Which of the following groups have an increased risk for mesothelioma? Choose one of the following options. 1. Construction workers. 2. Shipyard workers. 3. Textile workers. 4. All of the above. Correct. Anyone who works with or around asbestos has an increased risk of developing mesothelioma. Symptoms of mesothelioma depend on where the cancer starts. Select true or false. Correct. Mesothelioma can start in different parts of the body. Symptoms are not the same for all types of this cancer. Symptoms depend on where in the body the cancer started. The only sure way to diagnose mesothelioma is with a biopsy. Select true or false. Correct. A biopsy is the only sure way to diagnose mesothelioma.
Is stage 1 cancer more dangerous and advanced than stage 4? Select yes or no.
Correct. Stage 1 cancer is less advanced than stage 4. This means it is usually more treatable. Which of the following treatments are used to treat mesothelioma? Choose one of the following. 1. Chemotherapy. 2. Radiation therapy. 3. Surgery. 4. All of the above.
Correct. Chemotherapy, radiation therapy, surgery, targeted therapy, or immunotherapy may be used to treat mesothelioma. Sometimes a combination of these treatments will be used. Thank you for using Explain.